Hi, friends. Good evening. This is Dr. Chetna Jain again, Director and Senior Consultant at the newly opened Cloud9 Hospital at Sector 14. Today, we are going to talk on diabetes during pregnancy. So, I have spoken at length on diabetes in elderly, and we had a very good chit chat with Dr. Ila Sambar. You can check that on the Nima Health Show. So, you'll find a lot of details over there, and which is relevant for the non diabetic, but today, for the non pregnant. But today, we are going to talk about what happens when you get diabetic or if you're a diabetic in pregnancy. So the first thing is why diabetes is harmful. So one is it can have a fetal effects, maternal effects, side effects, and also it can have its own impact on the neonate and the mode of delivery. So if we talk of fetal impact, the major fetal impact is the baby tends to grow very big. Very rarely the baby could become very small. So either way, we want an average sized baby which is growing very healthily. It can also lead to excess of water inside the abdomen. It can make the placenta very thick, and it can lead to reduced blood supply to the baby. To the mother, during pregnancy, also the sugars are not good. It can affect all the body organs, but more so at the time of delivery. The wound may not heal well. There could be pus formation, infection, and other things. And that's the reason that you need to control sugars well. Now, how do you diagnose diabetes? Now, this diabetes is different than the standard diabetes, where the sugar measurements and the control is much more tighter than the adult diabetes. So here we're looking at a sugar value of between 70 and 94 fasting, and 2 hours post meal, that is the beginning of the meal, would be 70 to 118. So that's the target that you need to achieve and maintain all the time. A lot of you, when you see your sugars 80, you panic that, okay, low ho gaya. No, but that's not the case. 80 sugar low nahi hota. So anytime if the sugar is ranging bit above 70, you're perfectly fine. If you think you're dizzy, yes, you might be, because if your body is used to sugars like 180, 200, and suddenly it drops to 80, you might feel a little dizzy. But mind it, you get used to it in a couple of days. So please do not start drinking juices or having chocolates or coffee or something just to bring your sugar up. That's not the right thing to do. So, how do you diagnose diabetes? So, one is to do a blood test. Now, a lot of times there are strange things which can lead to diabetes. For example, if you're passing urine and you realize that a lot of ants are collecting near the urine that you have dropped, so that could also be an indication. If you're getting up middle of the night repeatedly, that could be an indication. If you think you're excessively thirsty, that could be an indication. If you're eating too much, that could another be an indication that your blood sugars are changing and you probably need a better control. So you can do a fasting sugar, a 4 pp sugar, that is 2 hours from the onset of meal, which could be done anytime after breakfast, lunch, or dinner. Or you can do the whole profile, in which you do fasting after breakfast, after lunch, after dinner, and then we know exactly what time of the day the sugar is fluctuating. There are other tests wherein we can give you glucose 50 grams, 75 grams, and do a various control or the challenge test or the tolerance test. All these are available. So all said and done, and then you have a 3 months blood test, which is known as the HbA1c, which tests. So whenever the patient says and shows that her sugars are normal, that's the best way to catch it. So 3 months sugar cannot lie, and if at any point we catch it high, then we know that the mother has not been controlling her sugars well. So how to control diabetes in pregnancy? Now, diabetes control is difficult, certainly, if you just depend on the diet and exercise. But those who are borderline can actually manage it. Women with polycystic ovaries have greater chances of developing diabetes, and so are women who have delivered bigger babies, or whose babies are big, or there's a family or personal history of diabetes in the past, and their sisters or the mother was diabetic in pregnancy, so these women can have greater chances of having diabetes. So if you have such a risk factor, you yourself are overweight, obese, or your age is around 35 or more, then also the chances are a little more. So once the diabetes is diagnosed, whether it is a pre-diabetic or diabetic condition, you need to control the diet and exercise and maintain a very healthy blood sugar level. Now, how often do you monitor your blood sugar? That's a very standard question. So the monitoring of the blood sugar is not done on a this thing that daily you have to do. It depends on your sugars. Now, some women are on a very low dose, like 250 mg twice daily of metformin, and these women may need monitoring probably every 15 days or so, while others are taking about 70, 80 units of insulin and about 2 to 2.5 grams of metformin every day. And these women would probably need monitoring very, very closely and sometimes to the tune of daily or alternate days. So it depends. So, so ask your doctor how frequently they would want to know your sugar levels. Other mistake that you guys do is whenever you're testing your sugar, you're pressing your skin very tight and, taking out the blood by pressing the finger very hard, and that might not give the accurate reading. So, though the modern glucometers are a little better, still the suggestion would be switch off your Wi-Fi, switch off your phone, switch off your TV, stay at least 6 meters away from all this, and then try to do it without actually pressing your finger too much and check how the blood sugar is. In spite of this, there could be some variation. Your glucometer can show -20 or -30 or +10 or +30. So you must check and probably in between calibrate with the lab so that you know that you are not at fault at any point of time and your accuracy is reasonable in order to change the dosage. And if at any point we feel that still the control is not good, then we need to know four readings from the lab, the blood test, the venous sample to know exact values and then manage accordingly. So the treatment of diabetes has the oral medications and insulin. Now, insulin analogs and other newer drugs are also available as required. We can always involve an endocrinologist who can help. But majority of the times you don't need to because very few women will have that kind of diabetes wherein they would actually develop some kind of severe complications leading to ICU admission. Majority of the women are very comfortable, very safe, provided they control their blood sugars well, and it is not any difficult task. If your gynecologist is cooperative, is you're talking to them, you're sending your readings regularly, and you're getting the feedback on how it can improve and how what you've been taking and how it can be changed and how it can be settled. Yes, a very close monitoring. But drugs are not the only way, as I suggested, that you must include 1 hour of physical activity daily, then you must have a low carbohydrate diet, you must have a small frequent meal, and probably that will, towards the end of the life, again will become the daily routine because whatever happens during pregnancy is likely to be precipitated in the older age, which is typically beyond 40. But a lot of times, if you are very fit, energetic, active, and you exercise regularly, you relax completely, you do not take much stress, then probably you can defer the whole thing, the whole spectrum to your sixth or seventh decade. It's in your hands to some extent. If somebody's having juvenile diabetes, that means diabetes which started in a very young age, then you would not be controlling it on oral medication and you would need insulin. And insulin is typically required multiple times in a day, at least 3 times. It could be more, or very rarely, it could be twice in a day. So, a better thing is to control your body weight, do exercise regularly. Do not believe that it is a deadly disease. It can be controlled well. The modern lifestyle, the diabetes is very rampant. Gradually, India is becoming a capital of diabetes world over. And we need to look into our genes. We know that we are genetically, we've been very weak when it comes to diabetes. We don't walk, we don't exercise, and we have aided the Western people and taken up their their habits, wherein we don't squat, we don't sit, we don't. A lot of so those guys they walk a lot, which we don't, and that is how we have difficulties. It is extremely important to exercise and do duck walk. You do pocha or you do any kind of activity wherein your pelvic muscles are working well in order to achieve a normal delivery because diabetic babies, they tend to be heavier. They tend to be quite heavier. They could be at least 500 to 1 kg more over and above the average Indian weight. So my suggestion is that please control your diabetes very well. Anytime you have any questions or queries related to it, you're free to text me. You're free to WhatsApp me on 9910907222. I'm going to repeat if you're going to get your pen or phone out. My telephone number is 9910907222. You may also leave a message with my secretary on 9958164333. So what I suggest is if you have any questions, you can drop them now and I'm willing to take up your questions. Diabetes is such an important topic that you must be careful. And if you're not tested your sugar, you must test it. And at the beginning of the pregnancy, if you did not have sugar, doesn't mean that it cannot come in towards the end. So if you think that, you have all the symptoms that I'm talking about, or otherwise also you must check your sugar every 2 months at least during pregnancy or more frequently if need arises so that you know your diabetes at the earliest and manage and monitor it with the help of your gynecologist to achieve the best prognosis for you and your baby. Thank you so much.